Invisalign is nothing but a newer form, a more friendlier form of orthodontics. It's a way to move the teeth through clear aligners. As of to date, there's been over probably close to 7 million people treated with Invisalign since its inception. That's quite a few patients that have been treated with just some clear aligners. And people they think, how can plastic move? It is not just plastic, your ordinary plastic. It is this incredible plastic that has been designed specifically to apply pressure onto teeth. Invisalign is a system and a sequence where we start with the beginning and the ends, and then individual steps on how to move the teeth correctly, and then trays are formed at each step. So literally when a patient starts Invisalign, we already have the end in mind of where it should go. And the trays are already developed for it. But Invisalign, when working with an adult or anyone who chooses teenager or an adult who wants to, it's clear aligners. They don't have the brackets and wires, so it's more friendlier on the soft tissue, the gums, cheeks, and lips. It doesn't tear them up. It applies more functional pressure to a tooth than traditional orthodontics. Traditional orthodontics is the bracket on the tooth with the wire in the bracket. So the wire is applying a force on the bracket. The bracket then is what moves the tooth. So then the forces are only applied on the front. What Invisalign can do is it cups the entire tooth and applies forces from all surfaces of the tooth that are touching the plastic aligner. And that just gives it a more friendly force and less pain and discomfort on the patient. So to do Invisalign, first we diagnose your need. We do a digital scan, which creates a digital model of the tooth. This digital scanner was developed by Invisalign, who is the creator of clear aligner therapy. And so it's a proprietary digital imaging system that we use, and we use it for a lot of other dental needs as well. But we create a dental model, we send that to Invisalign, and we work along with their technicians. On the main computer, the digital scanner will do a good simulation, but then what we do is we import that simulation into the main computer at Invisalign. And I've already filled out the criteria on what I like for each patient. And then so their technician will develop straight teeth according to my guidelines. And then they send that simulation to me, and then I tweak it. I literally walk through each patient, looking at each tooth and making sure that it has moved correctly. And then once that is done, I send that back to Invisalign, and they create the sequence of trays, sequence of aligners that the patient can remove in and out and take in and out as they use the aligner to move their tooth. I went down to Invisalign. Invisalign actually has their main computer lab in Costa Rica. The computer is the biggest computer I've ever seen that does this. So they've got such a vault history or a storage of data on every patient that they have ever treated, so they know how teeth will move perfectly. It's just an incredible way to do orthodontics without the traditional bracket and wire. That's exactly how Invisalign started. If someone had had orthodontics, and then what they do is, orthodontists of old, back in the day, they thought that once they straightened the teeth stayed. We know better than that today. Once the teeth are straightened, someone still needs to wear their retainer to retain the shape that in the place that we put the tooth in. So Invisalign started by just treating mild orthodontic relapse cases. But since that occurred, people using Invisalign have kind of driven it forward, making more demands out of Invisalign to treat better cases because of the way the patients have responded. So now Not only does Invisalign treat the relapse case where someone has worn braces and then didn't wear the retainer and their teeth have shifted, patients have driven it and practitioners have driven it to treat anything that traditional orthodontics can do. Some say yes, some say no. Okay, you have to get really close into someone's face to see it. Okay, if someone's that close, personally they're into my personal space and they're a little bit too close. But we have employees who go through Invisalign, and we even have some that wear the retainers during the day to help protect their teeth because they kind of like to clinch and grind. And people don't know that they even have them on until they show them. But if someone's getting so close, and then we do have to apply sometimes some attachments to the tooth to help the tray move the teeth. And at a certain angle, you might be able to see that little attachment. But for the biggest part of it, if someone's outside the normal personal space, they can't tell. Things are a little bit different with Invisalign. You can, on mild cases, it may be twice, 2 to 3 times maybe. You might want to see them at the beginning. You have to deliver the trays at the beginning. You might want to check them in the middle to make sure all the trays are in, or you can go straight to the end. So it could be 2 to 3 times. Then we have patients who are a lot more complicated case. I'm going to probably see them every other month, so every 2 months in those typical cases, because we want to make sure things are progressing and moving, and sometimes teeth are just stubborn and not moving as well as what we like, and that's because as an adult our bone starts to get a little bit more denser, a little bit harder, and we want to make sure that the teeth are moving, and we have ways to help that move a little bit faster. But if we don't catch it in time, it just prolongs or lengthens the time that we're treating the patient. Way to speed up a process of orthodontics, it's called accelerated orthodontics, and it's where we stimulate the bone around the teeth. You stimulate that bone. There's 2 ways you can do it. You can do it through a vibration device, which requires a lot more effort on the patient. They have to use this thing 2 to 3 times a day, placing it in their mouth and letting it vibrate. Then the other thing about it is we can do the accelerated orthodontics with a system called Propel, where we stimulate the bone to cause inflammation. What the everyday person doesn't understand is that orthodontics is done by causing inflammation. You apply pressure on the tooth causes the bone to become inflamed, and then the tooth moves into the position that it should. So it's inflammation that we want. So we increase the inflammation, the teeth move faster, and technically they move a lot safer when we do accelerated orthodontics, and because the bone is now stimulated for that inflammation, so they move a lot faster and safer. A lot of patients want to think they can change their trays sooner. That is a huge no-no. That's something they can't do. We have a system of why, and that's because we know how the bone is going to respond. If people think they can move their teeth faster by changing the trays out sooner, they can actually do more damage than good. They can push a tooth right out of the bone, and then you have a free tooth sitting in free space. So that's a big no-no to try to accelerate it by changing the trays faster.